Now I would like to talk about contrast enhanced ultrasound, the applications of this technology. I think you are familiar with this technology. We are now using two types of technologies, just like Zhang has said. And the first is MRI guided. There's also a ablation expert consensus and also ultrasound guided. Now, ultrasound guided has been more widely applied. So MRI, the efficiency is much lower, especially insert tech, equipment developed by them. Just like Professor He Ming has mentioned about the focal efficiency. So MRI expert consensus has been reached now. MRI guided, these are the advantages. It can monitor temperature change, but the folder is not here. I cannot open it. Ultrasound with the change of a grayscale, we can monitor and regulate, but not every patient can have change in grayscale. So though we say it's controllable according to the change of a grayscale, however, if there's no existence of a grayscale, then we need to find a way to avoid excessive treatment, but meanwhile also guarantee the appropriate treatment. If there is no intraoperative methods for evaluation, then you see the postoperative imaging. We try to make it up for what's not available intraoperative, but it seems to be a bit late. Now, here is the evaluation. As we know, in order to guarantee its efficacy, we have set up the intensity and the dosage. And what we found is that side effects become higher, or AE become higher. Therefore, ultrasound contrast has been introduced. So we did this research or trials on 72 patients. The result has been published. We used ultrasound imaging to compare with MRI imaging. You can see here preoperative fibroid volume. So one is showed up in ultrasound, the other is on the contrast enhanced ultrasound. So there's no statistical significance. Although numbers seems to be different, but there are no big difference. Well, for ablation volume here, ultrasound contrast enhanced ultrasound can be used for evaluation of efficacy during surgery. So this can help us to avoid, due to lacking of a clear change in grayscale, that we may provide an excessive dosage. That's very important point to know. You can see this patient, we can see pre-operative imaging, and so the contrast is very clear, and also post-operative, and the range it shows is very consistent.
And here is the same. You can see that before operation, in the operation, we can use the ultrasonic wave to just do the imaging. We can see here is the intensifying, and after for the post-op of the MRI, the result is the same. So from the perspective of the outcome assessing the ultrasonic, the imaging is very valuable. If after the post-operation post-operation period, if there's any residual of the myoma, we can see that here and here you can see these are the same in different imaging modalities. And after the follow-up treatment for the 72 cases, 7 cases has shown that the ablation is not enough, so we just followed up with the follow-up ablation, and then with the ultrasonic imaging, we can see that the ablation rate has been greatly increased after the follow-up ablation. So, and also we have just introduced the ultrasonic imaging, and this has just reduced the adverse event rate. And in 2010, when Professor Fleming was there, and she has reported that the proportion of the post-operation liquid removal is very high. So we just induced the sonoval, and we have just greatly improved the outcome. And also in hospitals with the ultrasound, the imaging, the occurrence rate of the blood mass is higher, and so we did a respective research here. It is the effect of the increasing the effect. So here are the 291 cases. And we can see the 162 cases are not using the sonoval, and so we can see the difference for the intraoperation, the assessment. We can see that the overall the radiation time has no difference, but as the gray scale of the blood masses are different. The arms, the cohort with the sonoval has the lower blood masses, and so we can see that this is a difference. And also, if there's any the time of the having the blood masses, they're also different. By using the sonoval, we can see that when the radiation is higher than the 60 seconds, then the grayscale of the blood mass has been changed. And for the groups without the sonoval, and there's no change. So we can see that this can bring the dramatic improvement to the outcomes. During this respective research, we can see whether or not there are any increased the adverse event. In these two groups, we can compare that there's no significant differences between these two groups of the adverse event. So we can see that the ultrasonic image can just improve the efficacy of the ablation, and the mechanism is a micro cavity effect. And also it could also introduce the thermal effect. This research is done by the German experts. With this kind of the micro cavity effect and the thermal effect, that we can just go forward, and we just did research of the sonoval effect, and we have this paper by us has been selected by the European journalists as the excellent paper, and this paper has we have just just chose the 80 cases of the uterine myoma and divide them into two groups. Before the research, 5 minutes before the FUAS research, we just used the angiography to just infuse the 1.5 milliliters of the Sonovu, and the control groups before 5 minutes group before the FUAS, the control group just infuse the 1.5 milliliters of the salt of the saline water, and so here we can see that after the treatment, the situations of the patients are like this. So we can see that the baseline groups and the control groups has no difference, and you can see that after the treatment, the experimental groups has used the Sonoway as the medication. Tension is the lower, and also the therapeutic time is shorter, and also the the timing for the ablation is 115 seconds, and also as the FE energy efficiency coefficient is higher, and the energy consumed is lower, and ablational rate is higher than the control groups. So we can see that the Sonovu can bring the better effect to the ablation, and about the adverse event, there's no significant differences. But the radiational pains, there are no difference. And actually, this is related to the position of the myoma. It's not related with the Sonoway. So we can prove that the Sonoway can be safely used on the ablation of the myoma. It could just reduce, and as the post-op, the adverse event is not different. And so we can see, in conclusion, the ultrasonic imaging could just dramatically reduce the energy consumed by the FUAS for the uterine myoma. It could just improve the efficiency without bringing forth any more the adverse event. So the ultrasonic imaging can be used perfectly with the UAS, making sure of the safety of the FUAS. Sometimes, for example, after the infusion, we can promptly start to treat the myoma. And also, the purpose of using the Sonovu is to just change the microenvironment instead of using the Sonovu to finish the ablation. So the safety is the purpose of the Sonovu. And also in different countries, in different jurisdictions, Sonovu has been approved, and in some other countries it has not been approved. In South Korea, they have been using the GE angiography agent. So we must follow the instructions of it, and by using it, we can just intensify the effect of the ablation. But we need to pay attention to the timing and the pacing of using the Sonovu. And in America, if we use the ultrasonic angiography, there is a case of the death. So the US FDA has just promoted the black box warning. And however, according to our solutions, if we use the ultrasonic angiography agent during the FUAS, the safety level is very, very high. And also, we want to mention the allergic reaction. And we have used the Sonovu for more than 10 years. During the past 20 years, there's only one allergy effect, and one case of shock. And also if there's any case of bleeding, it might be related to the dose of the angiography agent. Also, we do pay attention to the timing and the pacing of the infusion. And also during the past more than 10 years, there have been more than 10 cases of the 10 cases of the renal function damage after the operation. And this has just raised the question whether or not the ultrasonic angiography, the agent could just damage the renal function. Actually, they will be just be discreted from the patient's body. It might be related with the MRI, and most of the cases are happening in summers. Last year there are 3 cases in summers, one in Beijing, one in Hunan, one in Guangdong, and this year there are 3 cases. One case is in Shanxi province, one case is in Chongqing, one case is in another city. Most of them are in summer. So during the ultrasonic imaging, we need to just pay attention to the renal function, the damage that is mostly related with the MRI. And after the angiography, 4 hours after angiography, the patients must drink more than 2 liters of the drinking water. So during the ultrasonic imaging, the sonarble is safe. So thank you very much for your wonderful speaking. We know that for the uterine myoma, the changes of the gray scale is not so completely obvious. So with the angiography, we can just see the change of the gray scale. And Professor Zhang also cited a lot of the materials. It could just intensify the effect of the FUAS. It is a very good solution, and also this sonarble would also cause some of the side effect, for example, renal function damage or the or allergy. But if we just follow the instructions of the product, there will be no other safety issue.